Let's talk about different tissue changes, skin changes. Estrogen definitely changes your skin, or lack of estrogen changes the plumpness of your skin. Your skin dries out a little bit. All of the things start happening. That maybe you notice your jaw is not quite as firm as it used to be. The 11, the wrinkles on the forehead. This has a lot to do with the way your skin uses estrogen, and whenever you don't have as much, you're going to start showing the signs of aging. Skin dryness, including vaginal tissue, is caused by estrogen decline. The itchiness, if you start itching, it could be a sensitivity to your environment, and that's another symptom. It could be a food sensitivity, but it could also just be this lack of estrogen. It causes that skin itchiness. So if you are paying extra attention to your moisturizing routine, I know that I need to use almond oil or rose oil. My skin works better with oil than it does with lotion. A lotion just tends to coat. Oil actually penetrates. But I've always had a tendency to dry skin, so it's even drier now. You might also notice some scaly, patchy sections. There was a time that for months at a time, I would just have this what felt like a leather lizard neck. It was the weirdest thing, but it would also itch, and it would get irritated, and it would turn red, and then the texture was completely different. Just right here. Weird. You might notice skin redness that's different. You might notice the opposite. You might not get dry. You might get extra oily. You might start having adult onset acne in all kinds of places, not just on your face. Like when you entered puberty, if you had acne during that time, you had skin changes during that time. Perimenopause is called the second puberty or reverse puberty. So your body is going through some of the same intensity of changes as it did when you went into puberty. So you might have some of those symptoms or those signs of it again. If you have battled with eczema or psoriasis, it may actually get worse. It might show up new at this time. If you have unexplained irritations or new allergies in your skin or in ears, nose, and throat, any of those things, any itching or inflammation in any of those tissues, it can be blamed on this transition. You might be experiencing, along with vaginal dryness, you might be experiencing recurring UTIs or cystitis. That is also a sign or a symptom. The joint pain that comes along with menopause, that is one of the things that I struggle with. My joint pain is crazy. Like I'll have pain in my rib cage. Who has pain in their rib cage? You might not have pain, but you have stiffness. You might notice muscle tension. You might notice that you don't heal. Things that you didn't actually acutely injure are injured suddenly because you're not healing as well. And that's because of the way your body uses estrogen to manage your tissues. You're having to adjust now. Supporting tissues in the core, in the pelvic floor, those things might weaken unless you pay extra close attention to them. You might notice that part of the UTIs and the vaginal dryness is leading to what they call atrophy. But it's very important to pay attention to your pelvic floor health. And if you had a baby before the year 2000, I'm betting that you have trouble with pelvic floor health. This just wasn't talked about back then, and there was no pelvic floor therapy to recover from pregnancies and deliveries. I know from personal experience that there it just wasn't dealt with. I went back to the gym after my second son was born. The trainer, who knew nothing about training a postpartum client because no one did back then. My youngest just turned 24 this year. He put me on a decline bench to do decline sit-ups. I am 8 weeks out from delivering a 9-pound baby, and he puts me on a decline bench to do sit-ups. I peed on that bench. It just came right out. And I got up. I interrupted the set. I didn't finish them. I'm a people pleaser, and I wanted to do what he told me to do. But I couldn't, because it wasn't just a little wet. I didn't just wet my underwear a little bit. I peed, and I got up and I said, I have to go to the bathroom. And I know that there was a puddle and it dripped off of that because it was a decline bench. Humiliating. And I still have flashbacks when I try to do decline sit-ups. So if you have experienced that, you probably have pelvic floor issues, and it is important to talk to a good pelvic floor physical therapist to get that taken care of. You might notice that your feet are changing. Your arches might be falling. All of this can be directly related to the changes in your estrogen. Massage therapy is different for women in the menopause transition. Pressure needs might be different. If you find someone that is experienced working with women in this transition to do your tissue work and your body work, then they're going to use a different method because your muscles feel different. There's a lot of tension there that you can feel, but it's also palpable to an experienced body worker, and they'll be able to use good techniques to help you better relax and to work on your soft tissue. Also, hair thinning and nail thinning, it happens. If you are experiencing hair thinning, there are some things you can do for that directly contribute to that. You can take an extra supplement to take care of your hair and your nails. You might also want to look to your diet. You might just not be eating enough, and it very well may be this estrogen transition. Some of these things can be stopped and changed or mitigated by hormone replacement therapy. So talk to your doctor. If that's something that you are open to doing, there is no reason to suffer. You can get a good hormone replacement therapy, and it can help you out a lot in all those areas.